Tell us about RSV. First off, what does that stand for?
So respiratory syncytial virus is the name of the virus. We just call it RSV. And it's a virus that was discovered a little over 50 years ago, but it's the most common cause of serious lower respiratory infections in children.
And tell us basically, how does this work? It sounds like it's pretty nasty stuff.
It can be nasty. The virus infects almost all children by the time they're age 2. And children who have more severe disease tend to be those who are younger infants or who have other risk factors such as being born prematurely or underlying heart or lung disease.
And tell us how would I know if my child had this?
So the early signs of RSV infection are a runny nose, cough, usually a fever in young children. Now it can be hard to separate that from a common cold. One of the best ways for a parent to tell if it might be RSV is if the child is having trouble breathing, if it looks like they're working hard to breathe, or if they're having trouble breastfeeding or taking a bottle.
Wow, so you're on that threshold. What should you do if you think your child has this? I mean, do you bring them to the emergency room? What do you do?
Pediatricians are very, very familiar with RSV because it's such a common virus. So if a parent is concerned about their child's breathing or ability to breastfeed or take a bottle, they should go to their pediatrician. And the pediatrician can assess the child and determine if they're ill enough to go to the hospital or can be treated at home.
What are the treatments for it, and are there vaccines available?
A lot of us in pediatrics think we need a vaccine against RSV, and people have been working on one for over 20 years, and we don't have any licensed vaccines yet for RSV. There aren't any specific antiviral medicines for RSV, so the treatments tend to be providing fluids. Sometimes there are medicines that can help the breathing that we use for hospitalized children. And if a child is too sick to breastfeed or take a bottle, then they get intravenous fluids so they don't get dehydrated.
Does this ever require hospitalization? How severe, what's the range of severity for this thing?
So almost every child gets RSV. About 1 out of 20 otherwise healthy kids is going to be hospitalized with RSV. That rate is much higher in children who were born prematurely or who have chronic heart or lung disease.
So most children will be able to just be treated and continue their normal course at home?
Correct. Most children with RSV are able to get through it just fine on their own, and so having an RSV infection itself doesn't mean a child needs to go to the emergency room or to the hospital. The reason children are admitted with severe RSV infection is if they're not able to breathe well enough and get enough oxygen in their blood, or if they're not able to breastfeed or take a bottle.
Okay. And how many of these cases are you seeing this year, and how does that compare? Is it more severe this year than previous years?
RSV, we've seen dozens so far, over 50 probably this year. We see RSV very predictably year in and year out. So unlike influenza, where some years are severe and some years are mild, RSV is the most common respiratory virus in young children every winter.
So it sounds like if you're a parent, you're going to be alarmed though if your child is coughing severely and the symptoms don't seem to be getting better. How do you measure, 1 day, 2 days, a week? I mean, what? You're on that threshold, and I think if you hear your child coughing severely, you want to go to the ER.
I think a lot of parents get very nervous. When my children were young and were in daycare, I would see a sign on the daycare classroom door, "A child here has been diagnosed with RSV." And I sort of laughed because I thought most of the kids in that room have RSV. The only real indication for concern is if the child is having trouble breathing. So if the parents see that the child's chest is moving a lot and they're really struggling to breathe, or if the child is breathing too fast to be able to breastfeed or take a bottle. Cough alone is almost never a reason to have to go to the emergency room.
Okay, but this is kind of a normal rite of passage for kids, unfortunately.
RSV and other common respiratory viruses like metapneumovirus, all children get them. They usually get them early in life, and that provides them immunity to prevent them from getting severe disease later. Any of us who are around young kids get RSV as well in the winter, but since we've seen it before, we have a good immune response and we don't get very sick.
Okay, because my question is, it seems it's not that easy to differentiate between that and the common cold.
It's almost impossible for either a parent or a pediatrician to examine a child and say for sure if it's RSV or another common virus. And so the care for most of these viruses is supportive, oxygen or fluids if needed, so many times it's not as important to identify the exact virus.
Okay, but in those severe cases, some kids do end up here in the hospital.
Yes, we have a number of children hospitalized every year with RSV, and children, including children in the intensive care unit. And worldwide, lots of children in developing nations die from RSV. So we think it's a very important target for vaccine development to prevent those severe infections.
Why don't we have a vaccine?
Well, for two reasons. Vaccine development has been difficult because young infants don't make very good immune responses, so it's hard to make a vaccine that will stimulate a good immune response. And quite frankly, pharmaceutical companies are not very interested in developing vaccines for children.
Wow, that's kind of unfortunate.
It is. I think it may change. RSV is also quite common in hospitalized older adults. So we did a study a couple of years ago looking at adults over 65. And in adults between 50 and 65, influenza was the most common virus. In adults over 65, RSV and a related virus, metapneumovirus, were much more common than flu. So it's a problem in the elderly as well.
Wow. Any precautions you would give parents, and what can we do preventative? I mean, you know.
Without a vaccine, the most important means of prevention is hand washing. So although it's a respiratory virus and it's in the child's nasal secretions, the way these viruses are spread are hand contact. And so if everybody's very careful about washing their hands and using hand gel, that reduces the spread.
Okay, and just kind of hope for the best, I guess.
Most children will get through RSV just fine on their own. If the child's having trouble breathing or trouble feeding, then they should see their pediatrician.
Okay, all right, sounds good. Is there anything else?
We'd love to see a vaccine, but you know, children often don't have insurance, they often don't have money, and they don't vote. And so there's just not much drive in the pharmaceutical industry to develop vaccines for babies.